Getting rough between the government and the doctors in this upcoming doctor strike. The Health Secretary is now directly accusing doctors preparing to take this strike action of playing games with people's lives. And that's largely, he says, because flu admissions are rocketing.
The BMA is putting the government's offer to its members, but it doesn't include extra pay on top of the nearly 30% that the government says doctors have received over the past 3 years. So, should the resident doctors scrap their strike? We asked you what you thought.
Yeah, they should go on strike because they're putting themselves at risk. Obviously, catching the flu and stuff, and they do a lot for the general populations.
I think they should go into hospital to help with the Superflu.
I actually have a flu right now, so
Stay away with that microphone.
I'm coming off the end of it.
There's always going to be something. If there ain't the Superflu, there's COVID. If there ain't COVID, there's something else. So when are you going to strike?
It doesn't really bother me, because I don't really go see a doctor that much. So, I mean, if it benefits them, then absolutely.
Well, we're joined now by pharmacist Thuran Govind, who says that winter strikes are specifically designed to cause maximum disruption at patients' expense and should be called off, and Dr Pasha Mukherjee, a GP, who thinks that the strike should definitely stay on. I'd like to start with you, Doctor, if I can. There's a very famous quote by the economist John Maynard Keynes, who said, "When the facts change, I change my mind." When this strike was being organised and was about to be called, we didn't know that we would have one of the worst flu epidemics in this country in memory. And we have. And the hospitals are absolutely overwhelmed with cases, and it's going to get worse as the days go by. Could you not at least acknowledge that and at least postpone strike action until the flu epidemic has peaked?
I think it's really difficult, and this is where the strike was completely avoidable. It's still avoidable at this point, and this is where the BMA is taking the offer to the members.
Could you answer my question, please? Could you not look at the way that the landscape has dramatically changed health-wise in the last 2 or 3 weeks in this country and postpone the strike action until the flu epidemic has peaked? Could you answer that question?
And I think this is one of the things where if the hospitals really required doctors to be on shift, then absolutely doctors would go back to work. And that's actually written in the contract as well. Mm-hmm. It's a case of actually there lies equal responsibility for the government and resident doctors. So I'm not taking away the fact that it's still people's choice. And we did see overall, in the previous strikes, the number of doctors who were going on strike has reduced overall as well.
You're saying that if a hospital manager were to telephone doctors and say, "I have a massive problem here. I've got wards overflowing with flu patients and some of them are dying.
They have to show that they've tried everything beforehand.
They would break the strike and come in.
If the hospital has shown that they have tried to take all the measures necessary to prevent needing to reach out to the doctors. And this is where it's really important. They've had enough notice period to ensure the wards are staffed adequately, which, let me tell you, even on non-strike days, they're not meeting minimum staffing requirements in hospitals. And this is where the problem is. We do not have enough doctors because doctors are leaving the country because the pay is just not good enough. The working conditions are terrible.
Thuran, if you're a doctor, or indeed a nurse, but doctors are what we're talking about right now, then your job is life or death. There's never going to be a good time to take a stand. Why shouldn't they do this?
There may never be a good time, but there's certainly a very bad time to do it. And we've heard this morning about the extent of flu raging in the hospitals, the fact that people are calling critical incidents. Now, let's talk about this generally. I think the general public are fed up of strikes. The general public work very hard and are getting sick of hearing about people who are not going to work when they every day are working extremely hard and want to be able to access healthcare. I also think the doctors have had a pay rise. There has been movement when it comes to the doctors in this case. A lot of other professions have not seen pay rises in line with inflation. Further to that, we need to make sure that other parts of the health service are recognised as well. The porters in the hospital, the nurses, the hospitals and the NHS would not run without those people as well.
You've said, speaking as a pharmacist, that what the doctors are about to do, if they go ahead with this, is the equivalent of you refusing to issue a prescription.
I would say that you go into healthcare to be able to serve patients, and that must come first. And in terms of everything, this could be delayed. You could choose not to strike at the worst time of year when we know there's an unprecedented situation in terms of we haven't reached peak flu season yet. This is not the usual situation.
She makes some good points, doesn't she? Nobody decries doctors having, enough money to live, for goodness sake, after all those years of study and for the responsibility you have for all our lives. But across the board, a lot of professions are suffering. Other elements of the health service as well are not being funded. Do you think you're losing public sympathy?
I completely agree with what you're saying in terms of all members of the healthcare system are valuable. They absolutely are. And I completely understand that the public are very frustrated because they're the ones that are suffering and they're the ones that are getting caught in between. And it's really sad for them. But the reality is that they're getting caught in the middle even on non-strike days. The condition of the NHS is deteriorating every single day. And that is, I understand that everyone deserves possibly a pay rise, potentially, if there was the money for it. But at the end of the day, this has been ongoing for more than 2 years now, this discussion about pay restoration and working conditions. We're seeing the dire levels of corridor care at the moment because we do not have the infrastructure left anymore. And to work in those conditions with the pay, I mean,
Soren, a lot of people want to have fair pay, but they also want a health service that works, don't they? And exhausted doctors who can't afford to live, so therefore are giving up the thing that we paid for them to train for, exactly. You could argue. It's not going to help either.
I agree, but I would also say it's a privilege to work as a healthcare professional. What we know is whilst the pay may not be so great earlier on, we know there is the trajectory later in the career as well.
This is the problem. There is no trajectory at the moment.
Well, hang on, hold that point just 1 second, because we've got the results of our straw poll, which we've been running since 6 o'clock this morning. We asked, should doctors call off their strikes specifically because we have a superflu surge and Christmas is an incredibly busy time anyway. 85% of you said yes, call it off, postpone it at the very least. 15% said no. Do doctors care that they're losing that kind of public support?
Absolutely, but at the moment it's not. It's gone beyond that point. And the reality is, I love my job as a doctor, but more and more doctors, and not just talking about resident doctors, are getting pushed out of NHS into private care or leaving the country. Or if they can't do that, they're so burnt out, they're taking sick leave. People are going to find a way out of this, and this is going to impact patients also.
And what's your gut feeling? We're going to get the result of it's an unofficial survey that the BMA is conducting of its members. What do you think is going to happen? Are the doctors going to agree to call off the strike? Well,
I think it's a really good sign that the BMA has actually taken this offer to the doctors, because that shows that they think this is an offer worthy to take to the doctors. However, the government has proposed 4,000 spaces for training. We have 20,000 doctors who are out of work. We had 30,000 doctors apply for 10,000 spaces. So that's literally not enough. That's still going to leave about 16,000 doctors out of work.
Well, that sounds like the sort of thing that could be negotiated. But OK, thank you both very much indeed for coming and putting opposing views. We appreciate it.